Carly, I just remembered to press record, so we are all set. Okay, we're going to give it about 2 more minutes. We're expecting a few more people for sure. So hopefully people are able to connect. If you haven't done already, please write your name in the chat box. That just helps us know where you are listening from. If you are a family caregiver or if you're from an organization, feel free to say that as well. That just helps. And then we'll get started here in just a little bit. Deb, Christine, and Carol, glad that you could join us. This is usually one of the most popular classes. I think there's a lot of good information and we repeat it every year just because some people are in this situation this year and they may not have been in this situation last year looking for care. So that's also why we're recording it, so we can maybe share it with others. It's, you know, some new options that we didn't have before, before Zoom. So it's 1:02. I will keep an eye out for people to still connect and hop on, but Carly is the kind of the guru behind this presentation. I think, you know, Stephanie Hexel, when she was in Carly's position, kind of helped coordinate this class. And so now that's one thing that Carly's been able to take on during this time. So thank you, Carly, for all your work during this time. Like I said, I think it's a great presentation because it shares a lot of the services that are around the area, and just people might not even have been thinking about in-home services last year because maybe a diagnosis or something else changed for somebody. So thank you so much, Carly, for all your work in doing this. We are recording this just to let you know, but that is the purpose of sharing it with others as well later. If it would be, some people want to attend this but would like to have it in the evening, so we just try to make it flexible as well. So going to pass it on to you, Carly. I'll take some of the controls on the behind the scenes, but we should be good to go. So thank you.
Thank you, Sarah. Hi, everyone. I'm Carly Whetstone. I do outreach with Area Agency here. And I want to introduce the other panelists who will be helping me with this presentation today. Well, you'll still see them, and then I'll put the slides up. So first we have Rashay Nadevsky. If you want to just wave so people know who you are or introduce yourself. She's with Care Resources PACE. And then we have Bob Callery. He's with Area Agency on Aging too. Bob, if you want to wave. He'll be talking about Medicaid and Medicare. And then we have Jill Verbeek, and she's with Evergreen Commons out in Holland, which is an adult day center. And again, she'll speak on that in just a moment. So with that being said, I am going to share my screen and we will start the PowerPoint. If I can get it. There we go. So this presentation is really about in-home services and community resources and kind of what is available for yourself or loved ones in their homes. Our panelists, I know were already introduced. Here's just kind of our titles. So what is in-home care? It's exactly what it sounds like. So it's care that comes to your house. Most commonly, I think people think of housekeeping, having someone to come clean, prepare meals, help with personal care. There is such thing as private duty nursing, where someone could come help administer medication or do medical related things. That's not always included in kind of some of the programs we're talking about today, but I will differentiate that as we move on. And before I dive in too much farther, as far as questions go, if you guys have questions, I'm just going to ask that you put them in the chat. We will address those as we can. And if we don't have time as I'm speaking through the topic that you have a question on, we'll come back to it at the end or follow up with you afterwards. So feel free to submit those as I'm talking. I'll touch on them if I can, and if not, we'll come back to it. Okay, so what are my options with in-home care? Sorry, you can probably see that. There are several different options, and we will go through each of these. Private duty care, care management, MI Choice Medicaid waiver, and PACE. And then we will get to kind of like the second half of this, which is community option or community resources. So private duty care is probably what is most often thought of when you think of in-home care. This is kind of what I touched on already, the housekeeping, the meal preparation, personal care. And to clarify, personal care is kind of anything that's hands-on care. So that would be helping somebody with bathing, with going to the bathroom, maybe getting in and out of bed, transferring, those kind of things. That's what that is what's included within private duty care. Now, typically, this is not covered by Medicaid. It's typically paid out of pocket. It might be covered under other programs, but I think most commonly it's paid out of pocket, and we'll get to those other programs too following this. So that's the gist of what that is. And again, it can include more or less things. There are a bunch of different agencies that offer this in Kent County, but in all counties across Michigan and farther. I would say the average, just from my understanding, the average cost is about $25-ish per hour of work if you're paying out of pocket. That varies quite a bit from one agency to another. And if you are looking for private duty care, I would really encourage you to do your research. There's a lot of really great companies out there. It's not that I would be worried about. It's more that your agency that you're looking to partner with is going to be able to provide what you need. So I mentioned private duty nursing. Not all agencies are going to offer private duty nursing. So if that's something that you or your loved one would need, if they maybe need to take a shot every day or something like that, and would need a nurse to do that, not every agency is going to be able to fulfill that need. So that might be something to just be aware of when quote unquote shopping for an agency to help. Cost is a factor too for a lot of people. So you can compare those prices. And then the other thing is some of these agencies will have minimal hours required to come out. So if you need somebody to come help mom out of bed in the morning, and that really only takes 30 minutes or maybe an hour, some agencies might not come out just for that short amount of a time. They might say, we won't come out unless we'll be there at least 2 hours or 4 hours or whatever it might be. So that's something maybe to ask too, because some people have a lighter amount of needs. They really only need an hour in the morning and that's that. Or some people operate more on, they want someone to come and just kind of clean up their house once a week for a couple of hours. These are things you'll want to talk about with the agency that you're going through for private duty care to discuss if those options and those goals are attainable or not. So we will move on to some programs that cover private duty care. My computer, there we go. Care management is the first one. This includes personal care and homemaking. So we have care management through Area Agency on Aging here. And we'll have all of our information at the very end if you are taking note of some of these things and are wanting to make a referral for yourself or others. We will have that information at the end. But care management offers, again, personal care and homemaking. You have to be 60 or older and in need of help with personal care, homemaking, and ongoing management of your care to qualify. So this program tends to be more for people who are a little bit more independent, not necessarily always the case. But this is really good for people who are still able to do a lot of their own day-to-day and maybe need help with just some light housekeeping once a week, kind of like earlier I gave that example. Or maybe this person has cognitive impairment and just needs someone to kind of organize their care for them, and they're kind of fine as long as someone is setting that up for them. Different things like that. It can cover a lot of different kind of situations. I will say there's a wait list for it, and that has changed a lot with COVID. I always recommend that if you are interested in this program for yourself or someone else, to go ahead and call sooner rather than later. If you or that person get up on that list and you are not yet in need of that care, or if you've kind of changed your mind and don't need it, it's no big deal. We'll take you off the list and we'll move on to the next person. So I would just encourage that referral if that is something that you're wanting, just so that you don't have to wait any longer than you have to. And I want to note too that Reliance Community Care Partners also has this care management program. We actually share this program with them. And what that means is that we have the same waiting list, and we can both pull from that. So what's most common is if you make a referral to area agency, someone from area agency is going to take on that case. But just so you're aware, someone from Reliance could also pull that. And a reason why that might occur sometimes too is because Reliance and area agency cover different territories. So Reliance covers some counties that we do not. So sometimes we'll get a call for someone in a county that we don't cover, but they do. So they could pull that person. So it's kind of getting care to the people as fast as we can. And it's also meant to give people an option. So if you really have a preference on working with Reliance or area agency, when doing that referral, you can always say that you have that preference of which agency to work with. So just a little background on that. And then how do I pay for it? Well, this program is for both Reliance and area agency. It's covered through the Kent County Senior Millage, which we'll get to later on in this presentation, and the Older Americans Act. And it comes at a cost share. So a lot of times this program is free or very, very discounted for people. We'll look at your income and figure that out with you before we start services so that you have an expectation on what that will cost. But it is typically very affordable, thankfully, through the Kent County Senior Millage and the Older Americans Act. And I always like to say too, I'll probably mention this again when we get to the senior millage, that you don't have to be low income to get some of these services at a cost share, at a discount. I know a lot of our programs are geared towards lower income, well, I guess not even, but Medicaid, which tends to be. And this one is not necessarily, you don't need to be low income to do that. So that's care management. I don't think I'm seeing any questions. Let me double check. I think we're good. Yep. Okay. So then we have the MI Choice Medicaid Waiver Program. This is kind of a complicated program, if I'm being honest, but it's a really, really great one. So bear with me and ask questions if you have them. What this program is kind of an expansion of care management. So this program will offer in-home care. It will offer personal care, help with bathing, toileting, transferring, all of that. This one can offer private duty nursing if there are concerns with medication or whatever that might be. This program can also help set up things like an emergency button, that life alert or personal emergency response system is what we call them. This program can help with medication management, respite care, home delivered meals or meals being prepared at the house, which is something our care management program does a little bit of as well. This can also offer mild home modifications and changes to make sure that the house that the participants are living in is safe for them to navigate. So it does a lot. I guess catch would be that it's pretty specific in who it serves. So there's certainly a need. We have over 900 people on this program. So the person out there exists, it is pretty specific on who that person is. So you do have to be at a nursing home level of care. And what that means is that you would have to be medically eligible to live at a nursing home. So we'll get to this in a minute, or I'll forward a slide here and come back. But if you look at these ADLs and IADLs, which are activities of daily living and instrumental activities of daily living, this program asks that you have trouble with at least one of these, or you would require help with at least one of these. And really with the ADLs is what we're looking at a little bit more closely. We can certainly help with the IADLs with the services I kind of already mentioned, but for eligibility, we're looking more at if this person is going to need help with transferring, with bathing, with grooming, with a lot of that personal care. And let me come back because that is just kind of the medical side of qualifying. So the other half of qualifying for this program is going to be income-based. You would have to be eligible for long-term care insurance. It is right in the title, but it is a Medicaid program. And Bob will talk more about Medicaid here later, but what that means too is you can't have more or a higher income than $2,349 a month. And that is set by the state. We have no say in that, and it's very precise. If you make $2,350, that's $1 too much. So just to be aware that that's very exact in what they are looking for. And then there are asset limits to this as well. The asset limits are, in my opinion, where things can get the most confusing. So we would really encourage you to call, and we are happy to talk through kind of your individual situation and financial scenario and all of that thing. But if you're just a single individual wanting to join this program, you make less than $2,349 a month, your asset limitations would be up to $2,000. So typically a house and a car do not qualify or do not count as assets. And I say that lightly because there are times that they do, it's just not that typical. So then the $2,000 usually comes from any savings someone might have. That could be retirement accounts. If people have like a second house or a cabin or a boat, things like that could count towards assets. Another thing we commonly see that people forget, and then once they do realize it, it could make them ineligible. And that would be having a life insurance plan that is, you have the option to cash out. So if you have that option to get cash that way, that is going to count as an asset. So the reason this is so kind of peculiar in eligibility requirements is because it is the payer of last resort. So, and again, I always want to reiterate, we will help you through all of this if this is a program that seems fitting. I know it's a lot of information, so please try your best not to be overwhelmed. But we, no, I lost my train of thought. Yeah, we'll help you with this with the assets too. I lost my train of thought, I'm sorry. So one other thing I missed on here too, as far as requirements, is you don't have to be 60 or older to qualify for this program like you do most of our other programs. For this one, you have to be at a nursing home level of care. So if that means you are 25 with a certified disability, then that could potentially still qualify you for this program. You'll see here it says 18 plus with a certified disability or 65 and older. So if you are 65 years in age or older and don't necessarily have a certified disability, but you are still at that nursing home level of care, you could still qualify that way. You wouldn't, it's kind of an either or. So that's the brief overview of the Medicaid waiver. Again, here are the ADLs and IADLs. I put this on here so you could see if any of these things stick out to you as things that you or your loved one or whomever would have trouble with, to note that these are things that we could help with. So in some ways, this is kind of like an alternative to a nursing facility. And I also say that very loosely because it's not 24-hour care. It could be daily care, but it's not going to be for everybody for that reason. So we will send out a social worker and a nurse to do an assessment. Of course, make sure that it's fitting and that it's safe for you or your loved one. We will set up all of the programs that would be needed then to make this a safe program for the participant. And if that means making those home modifications or setting up in-home care, that's what this program is really all about. So that's My Choice Medicaid waiver. And I am going to pass this over to Bob to talk about the Medicare home health benefit.
Good afternoon, everybody. So I always like to start when I do this presentation as a reminder that Medicare is a health insurance program. So this is a program that is not intended for long-term care needs. You go into any of their materials and they explicitly will outline that this is not, long-term care is not something that Medicare covers. So I always like to keep that in the back of my mind, especially when talking about Medicare's home health benefit coverage. Surprisingly, this is not a topic that our program receives many questions on. So what I've done is actually created a cheat sheet. And so for our few slides here, these are actually just screenshots from our cheat sheet for this information. So in looking at what Medicare's home health benefit covers and does not cover, these are kind of the outlines for those benefits. So in looking at the coverage, you're talking about skilled nursing care. So these are services that a nurse would have to provide. So changing dressings, teaching about dispensing of medications, giving any IV medications. There are times where we'll have questions about, well, what about some other services, some other in-home services? If it's not something that needs to be done by a nurse, then this program would not cover that in most situations. So a lot of the custodial care would not be covered. However, there are some times where custodial care could be included in Medicare's home health if those services are needed in conjunction with the other skilled services that are being provided. So there are a couple little caveats, and it's going to be situation based on whether those types of services would be approved for the beneficiary or not. So we have our different therapies that are covered for services, different medical social services, supplies. For the durable medical equipment, while DME falls under this home health benefit, it also falls under the standard Part B Medicare benefit. So any DME, any durable medical equipment would fall under the 80-20 rule. So Medicare is going to cover its 80%. The beneficiary would be charged the 20%. With all those other services, Medicare would cover those at 100%. Identifying a few of the services, again, that are not covered by Medicare. So again, the 24-hour care, home delivered meals, and then the various homemaking services. So we'll get lots of questions on that. And so we'll just educate people on what these benefits are and identify what can and cannot be covered. So next slide. So there are 5 conditions for qualifying for Medicare home health. So you have to be under the care of a doctor. There has to be documented face-to-face interaction with the doctor, and then there are certain required time frames that has to be done in. The doctor is going to have to certify a need. So there is going to be the need for these skilled nursing services. And then Medicare has time frames that those services are needed. And so we have those highlighted right here, identified right here. Again, the different therapies that would fall under the doctor certification. You do have to participate with a Medicare certified home health agency. The best way to find out what organizations participate and are certified through Medicare is actually through the Medicare.gov website. They have lots of different search tools on there, so different provider search tools. So they have a category specifically set aside for home health agencies. And then the last condition is the need for homebound. That should be on the next slide. So the beneficiary has to be homebound. So kind of what does this mean? It means the person, it's not recommended that they are going to leave their home. It's going to be a very taxing very taxing on the person to leave the home, whether that's any activities that they would normally participate in. It's going to be a difficult chore for them to be able to leave the home. They're going to need help from another person. They're going to need a wheelchair, a real taxing effort to be able to leave the home. But they are still allowed to leave the home for doctor's visits, for church services, for any other special events. This doesn't mean that they have to be trapped in the home, just that it's a very taxing task to leave the home. So that's the kind of the homebound definition for Medicare. And the last thing I want to point out, what we've been talking about is the Medicare home health benefit. So this covers traditional Medicare benefits and also through the Medicare Advantage plans. However, with the Advantage plans, these are HMO and PPO policies, so health maintenance organizations, preferred provider organizations. So these, the Advantage plans have provider networks. So in order to utilize these services, if somebody qualifies, they would have to participate with an in-network provider to carry out those services. So anybody who is in one of those plans, their doctor might suggest a certain home health agency. They would want to double check with their Advantage plan to make sure that that provider's in network, and if they're not, to try to find talk with the health plan to find out which providers they do have in network. So that is kind of the overview on Medicare's home health benefit.
Thank you. Sorry, I had to unmute myself there. Next, we'll move on to PACE. And Rache, if you want to take it away.
Yes, good afternoon. My name is Rashayna Dusky. I'm the Community Outreach Representative for PACE, Care Resources. So you're probably wondering, what is PACE? So PACE is the Program of All-Inclusive Care for the Elderly. PACE is designed to be a one-stop shop for medical care and to be an alternative to nursing home placement. 87% of seniors 65 and older say they wish to remain in the community as they age. Can you go to the next slide? So the barriers or the realities of aging in place are transportation barriers, managing many medications, difficulty with balance, social isolation, and navigating this ever-changing healthcare system, especially with everything going on in the world today. We're finding a lot of seniors, their families are having increased difficulty managing the system. Next slide, please. So at PACE, you are the center of all we do. Imagine you or your loved one is in the center of this wheel, and all of these services are wrapped around you to help support you to remain at home for as long as possible. Our services for PACE and Care Resources is just the PACE program I work for. We are all in one building. We are really set up to be a one-stop shop. So we have a day center, which before COVID, our participants could come to the center. It is open Monday through Friday, 8 to 4:30. Now, the participants come to the center, and we have recreational therapists that help with enrichment and activities to reduce social isolation. And it's just kind of a fun place to be. Right now, there's fewer people in the center and staff, but we have like a Halloween door decorating contest going on where the staff have done up these themes and our participants are going to vote on who they feel is the best. So it's really a fun, upbeat place. The medical clinic is at our center also, and we have 3 physicians and a physician assistant. And if someone would like to keep their primary care doctor and see that physician twice a year, we do allow that, but that physician does need to be willing to coordinate with our physicians for the care. We have some home care services, which we have recently increased more due to COVID-19, and I'll talk a little bit about that later. But with the home care, we can help with personal cares, bathing, toileting, transferring, light housekeeping, maybe grocery shopping, some things that will just make it easier for the participant and also the family member to just carry out those day-to-day tasks. If someone does need rehabilitation services, we have a state-of-the-art therapy gym with our own occupational, physical therapist, and speech therapist. And so that is based on the care planning, if that is needed and how often that would be needed. Another great part of the PACE program is medication coverage is included. Care Resources has our own pharmacist and our own pharmacy on site. We will deliver the medications to the participant's home or sometimes they may be sent home with them or picked up, but generally we would deliver those medications to the home. There are no donut holes with our program, no co-pays or deductibles for medications if someone's enrolled in PACE. We do need to get those through our pharmacy. We have a team of medical specialists, so we offer dental, vision, hearing, and foot care services. And also we have a network of specialists outside of that, like cardiology, neurology, whatever may be needed. So if our medical team says that is something that is needed, we would make a referral and our scheduler would actually schedule that appointment and do all of that. So it takes some of that pressure off family and their loved one of having to do that. We have dietitians and also to-go meals. So similar to home delivered meals, but we call them to-go meals. So depending on the needs, we would send those out. It could be several meals a week, a few meals a week. It really is very individualized based on someone's need. Transportation is included in the PACE program. Care Resources has our own buses and our own bus drivers, but we also contract out with agencies if we are unable to meet that time or that need. So it is a covered service for medical appointments and to and from our center. We have social services. We have MSW, master's level social workers, that everyone gets assigned a social worker when they enroll. So they can be there for support, whatever that may be. We are, with COVID-19, we have really started increasing the amount of calls our social workers do. And we have done what we are referring to as happy calls, just upbeat calls, just to check in on someone, just to chit chat, see how they're doing, with the goal of reducing isolation and boredom. Because as we all know, as we were on stay-at-homes and many of us now, social distancing and not doing our normal social activities, it can get very taxing on someone emotionally. So we're really putting all hands on deck to kind of lift everyone's spirits in whatever way possible. The great thing about PACE is, we wrap all these services around someone, but what we also find too is oftentimes ER visits are reduced because we have staff on call 24/7. So if it is after hours and there's a medical concern, then there is a number to call and you will get a nurse calling you back within a certain amount of time who will look at the next steps and kind of where to go from there. I'm just going to talk a little bit about some of the things that we have changed a little bit since March with the start of COVID-19. So we have started telehealth visits where we're doing more visits electronically. We have iPads and tablets that we can utilize. You're using like avatars to help with some of those home care needs when possible, as far as like reminders for meals, medication, getting dressed. So if that's something that's appropriate and would be beneficial, we are able to add in some technology oftentimes, and also have people go out with the right protective equipment when need be also. So care resources, the day center is currently open but a limited capacity. So what we have done in response to not being able to have our participants come in as often is distributed activity bags. So our staff made up bags and sent them out to the homes. And so from March 16th to October 17th, we have distributed 6,160 activity bags. We have increased the home care hours because our participants were not coming to the center as often, and the total amount of home care hours since March 16th is 24,080 hours. So I just say that to know that even though things look differently out in the world, we are working around that and caring for our participants, so we are able to meet their needs. Can you go to the next slide? So you're probably wondering if there is a cost. So for most, there is no cost for PACE. It's covered by Medicare and Medicaid benefits or Medicare and private pay. Long-term Medicaid, it's similar. It's really the same criteria for Medicaid waiver it is for PACE if you're looking at Medicaid. The gross monthly income is $2,349 a month. Assets for a single person have to be less than $2,000. As Carly was saying, generally a home and a car are excluded. And we just ask if it's a married couple just to reach out, because that gets a little more tricky in the amount of assets you can keep. And oftentimes people would still qualify for Medicaid and they think they don't. So we just ask you reach out to us. And then, can you go to the next slide? Who can enroll for PACE is individuals 55 and older, care resources services Kent County and portions of Ottawa County, but there are other PACE programs throughout Michigan. Not every county has a PACE program, but if you are on the call today and you think this would be a good service for someone, please reach out to me. We can see who would be your local PACE agency and get you in touch with them. For PACE, they need to meet nursing home level of care. You know, Carly was talking about that a little bit earlier as far as Medicaid waiver. It's the same level of care. And then to enroll in the program, it's, you know, once you meet this criteria, or if you think you have someone that meets the criteria, you can just reach out to us, give us a call. We will talk on the phone, can set up a time to come out to either do it in person or a virtual Zoom meeting if you're more comfortable with that. And then we can explain kind of the next steps of the process. So with the PACE program, we can only enroll at the beginning of a month, and we can only disenroll at the end of a month. So generally, the sooner we get the call, the better, because if we need to get Medicaid, then that can make it a little longer to enroll. But we will talk about that on an individual basis and get the assessment going. So you don't have to have active Medicaid to start the process. So I think I don't know if there's questions, you can type them in, or I can answer those at the end.
I saw just the one question. Oh, I think that was just sent to me. Are there more in-home programs due to COVID? And you did touch on that. If anyone else had any questions at all, otherwise we can move along. Okay. All right. Well, I'm going to move on to Choices for Independence. If you have questions, feel free to still throw them in the chat. Choices for Independence is a program through Area Agency on Aging. I don't think I mentioned this yet, but I am a social worker. That's my education background. So I do this program, and what it is kind of the goal is for it to be a one-time kind of educational meeting. So I'll come out and meet with you and your family or whoever you'd like to have present and talk about your specific situation, your concerns, what your goals are for yourself, and kind of what might be out there to help you with that. So I see a wide variety of people. Sometimes people are more in crisis mode and need some sort of program right now, and other people are looking years down the road, wanting to just know what to do when X, Y, or Z happens. Who do I call then? So it's kind of for anyone who's just looking to talk about long-term care options. I had been doing these in person until COVID hit, of course. So now they've just been a phone call. So super, super simple. Most commonly, I think I see people who and this is most commonly, this is not everybody, but I see a lot of people who've never had any services before and don't really know where to start, because it can certainly be very overwhelming. I mean, I think that's why we have this whole presentation today, to break down some of the questions that you might have. And these appointments kind of focus on that too. So I see a lot of people who haven't had services yet. I make a lot of referrals for Meals on Wheels and a lot of the other community services that we'll touch on in a few moments here. But yeah, it's kind of just a good place to start. And if you have questions about where to go next with your care or with what programs might be out there, I'm happy to help the best I can with that. This is available in all 9 of our counties. And then I didn't put it in here because it's kind of for a different audience, but we have another program that's essentially the same thing, but for those who are in a nursing facility. So if you're in a nursing home and wanting to talk about local resources and programs, we also offer that too. So just an FYI. And now we're going to switch over to community resources. So I will touch on the Kent County Senior Millage again. I know that was brought up with care management. Then we'll have Joe talk about adult day centers and Evergreen Commons specifically. We'll have some time for Bob to speak on MAP, which is the Michigan Medicare and Medicaid Assistance Program, respite services, Meals on Wheels, and transportation. So the Kent County Senior Millage, this I wish the whole county knew about. I was going to say the whole world, but it wouldn't matter. This is a program specific to Kent County, but many other counties have something kind of similar. What this is a tax for all of those living in Kent County, and the money that is raised through that tax goes towards a bunch of programs. I believe that was sent out to you all, or the link to find it was, but this has so many services for so many different levels of need or levels of care, which is one thing that I really like about it. And I think a lot of people who are kind of caught in the donut hole of different programs can benefit from this. So it's something I hand out a lot to clients when I see them, or tell other professionals about when I'm doing my outreach stuff. But just to read off a few, there's help with adaptive equipment. You can rent or buy gently used medical equipment at a discounted cost. There's adult day services, which again, Joe Verbeek will touch on. Bathing services, our care management program falls under this. But there are even, there's caregiver support. There's just a bunch of different things in there. You can check that out if you haven't seen it yet online too. And one reason I like to highlight it, other than what I've already said, is that it comes all at a cost share. So most people end up not paying anything, or they pay a very minimal amount for the services in here. And again, they can fill that gap of what might get lost in other programs. So you'll see on this slide too, you'll have to be 60 or older to benefit from the senior millage and then to live in Kent County. And that is just specific to the Kent County Senior Millage. Again, other counties have similar things, but they would be covering different programs. A lot of times if you just Google like Allegan Senior Millage or whatever county senior millage, something will pop up. So you can go about it that way too. You can also reach out to area agency and we can help you with that too. I know we have a lot of people from Ionia Commission on Aging here today too. And then just so you know, for the year of 2020, we had over $12 million go towards these programs. So it's a significant number. I mean, you think about that, that's about $1 million each month that we're putting towards our community and to our seniors. So that is that. And then this is the link down at the bottom if you did want to find the printout of that directory. And then adult day centers, I'm just going to touch on this first part and then pass it over. What do they offer? What do they cost? And who can attend? Adult days, you know, I'm just going to pass it over. Joe, if you want to take over, this is your thing that you know most. So Joe, if you want to take it over.
Okay. Thank you, Carly. It's really an honor to be presenting for the Family Caregiver University. I am so excited to share information about adult day services. I'm sharing it for the whole state of Michigan, really, as being chair of the Michigan Adult Day Services Association. I have been part of this industry or service for over 25 years, actually over 26 years. Nowadays, most people change careers after 10 to 15 years. However, I believe I'm as passionate about this program or these services as I was 26 years ago, maybe even a little bit more. So next slide. Let's talk about what is adult day services. It is a community-based group setting program. It provides a wide variety of both social and health services. So in my past career, I was an acute care nurse in the hospital, and then I also was a home health care nurse. And when I was a home health care nurse, I loved home care. And I loved visiting my patients. They could not wait for me to show up. They'd get me coffee. They wanted to sit down and visit, find out about my family, all of that kind of thing. And what I realized is that they really wanted the socialization of my visit. I was very limited in my time. I would see 5 to 6 different patients throughout an 8-hour day and travel from place to place. So I was not able to sit there and visit with them. Now I have the wonderful opportunity at the day center. I could do that. I can have a cup of coffee in the morning with our participants, eat lunch with them, reminisce about their past careers, talk about the weather. Or yesterday, I walked back to my office and saw a small portion of the Carol Burnett show with Tim Conway. It was the funniest thing, and everybody was just laughing. So I see this whole program and the day centers around the state of Michigan and in Kent County and our region as providing that camaraderie, that socialization, but also having some nurses available. The last thing that on this slide that I want to talk about is that it gives caregivers a break. Respite is what we call it. And as a former caregiver for my father-in-law, I know that at times this can be very, very demanding. So appreciate that there is a place. My father-in-law attended our day center for 4 days a week. my mother-in-law was unable to emotionally handle it for the day-to-day 24-hour, 7 days a week. So it was very beneficial for our family. Next slide. So who should come to the adult day centers? Daniel Kuhn, author of Alzheimer's Early Stages, says when your loved one isn't able to care for him or herself or able to perform routine daily activities, he or she may need to be considered for adult day services. Next slide. So who else besides those individuals that may have Alzheimer's or some type of dementia? It could be an adult who feels isolated, really is not able to get out much, and doesn't have the capability of socializing with others by themselves. Individuals who feel depressed, probably in our center, we do a geriatric depression screening on admission. And I would say about 50% of our folks have a small indication of, or slight indication of some depression. Someone else who may need help with medications or meals. Talking about the person that may have diabetes and needs that insulin at the noon hour, but the caregiver is not always available to be there at the noon hour. That person would very much qualify for coming to the day center. And then we already talked about individuals who have dementia or Alzheimer's. Another type of person that may really benefit from coming is those that have chronic medical conditions. They may have severe arthritis. They may be at risk for falling. And if they were left at home by themselves, they would have a lot of fall episodes happening. And then individuals whose family caregiver just needs some help. Those are very important. We believe that our caregivers are also our clients or those that we serve. Next slide. So, okay, we know now what types of individuals will come, but what are some of the issues? What we hear is that a caregiver may say, I'm worried that my wife is unhappy, just sitting there, not doing much, bored. Another one may say, I'm frustrated because I never have any time for myself. And another thing is, I am having trouble coping with my husband's behavior issues or challenges. Those are all issues that we hear on a daily basis when we're admitting people into the day center. Next slide. So what do we do here? What activities are we offering? I talked a little bit about social activities. They interact with other participants in planned activities for individuals. We find out from each person that comes to the day center what their past history was as a career or a homemaker. What interests? Did they like knitting? Did they like fishing? And we try to schedule activities around each one of these person's interests. Now, it may be a little difficult, but what we end up doing is having choices for people to come and participate in an activity. So every hour we have 3 different activities going, sometimes 4, and people have choices of what activity they're going to participate in. Next slide. So those activities may be some physical gross motor activities, using those large muscle groups. Doing gross motor activities promotes general health and helps keep that individual retaining the functions of those muscles. So we have even seen some improvement in physical ability after coming to the day center for 6 months, 12 months, that kind of thing. We offer exercise, group exercise classes at least twice a day. It's our most popular thing. Then we also offer like gross motor activities like bowling, horseshoes, and people love that kind of activity also. Next slide. Okay, music, it's awesome. It is what is woven into a lot of our activities. Exercise groups, we have music in the background. It is the activity that offers people the most joy, I feel. And we've known, I hope I'm maybe sharing something new for some folks, but persons with dementia may lose some of their language skills, but you start singing an old hymn or you start singing some of those old songs, you will see the person with dementia start singing along, even though they rarely have talked in the last months of their life. Benefits for music: it creates memory concentration. It's a connection to the other people in the group that are singing. It's a teamwork approach. We have musicians come in and they will say, what song shall we sing next? And the whole group makes that decision. And it gives a sense of community for the individuals that are participating. Don't know if you can see the picture on the bottom, but we have a bell choir. So everybody is given a bell, and together, yes, thanks, Carly. Everybody is given a bell and they play a song. Now, normally it's in their music, it doesn't necessarily say this note, but it will be this word that they have to ring their bell on. So people absolutely love that bell choir. Next slide. Okay, we also provide cognitive stimulating or educational activities. Research has really shown that cognitive stimulation activities improve memory and attention. We've had a number of caregivers say that after their loved one has attended the program, they seem to have improved memory. They can have improvement in their attention span. We've seen that in a number of places. So we assess people every 6 months with what we call a mini mental state exam. And occasionally we'll see some improvement. Now that's not always true, especially with those with Alzheimer's or another type of dementia. That disease is usually progressive. But if we can maintain someone at a level for 1 or 2 years, that is an absolute wonderful goal for them. So we have seen that over and over. About 70% of our folks will maintain their cognitive level. And I do believe it's a combination of socializing and being involved in stimulating activities. Next slide. Okay, this one's interesting, and it was really a new concept for me. You know how when you go to school and you are taking an art class, it's always, oh, how does that art project turn out? And can we get praise for it? Did I get an A in the class? Our art activity is not based on that it has to look good. Art is not what is done, but it's in the doing. And so a lot of times people will say, well, my loved one has Alzheimer's disease and there's no way they can produce anything anymore. It's amazing how if you just let the person participate in an art project, that individual definitely can do some things. Sometimes it's not necessarily what is so beautiful, but it's definitely a benefit to them. So in our building, what we have done is with a number of our art projects, we put a frame around it. What do you call it? A border around it. And there is amazing, if you ever come to visit our center, you'll find some of the art projects in the art up on the wall. I have a number at my home also that I take home, and it is done by a person with dementia or Alzheimer's disease. So again, it's the important part of it is to be involved in some activity at this stage. So art is kind of throughout all of this. We also do fun things like reading a poem out loud, talking about an art project, and we bring a therapeutic artist in once a week. And what she has done is more than just the product or doing the art project itself. She'll talk about it. She'll, I can't think of anything right now, but pumpkins. Then she'll go into how many people have pumpkins and what did you do with pumpkins when you were growing up, that kind of thing. So it's much more involved than just carving a pumpkin or painting a pumpkin. Next slide. What other services do we offer? We do offer personal care, assistance in the bathroom. We offer assistance with meals. The majority of our participants are able to feed themselves, but there is one or two individuals that may need some assistance or some cueing. Here's your fork, Joe, here's your spoon, or assisting them putting some food on. We try to let every individual do as much as they can. We do not want them to be dependent that they absolutely need us, but we also want them to succeed. We provide bathing or shower. Most of the adult day centers do. I know one in Grand Rapids will be starting that, I think, in the future. And then foot and nail care, health monitoring. I am almost sure that all the day centers have some nursing services. Some are full-time, some are part-time. In our center, we can administer medications, do some glucose scan, blood sugar checks. Each day center does have their own services in that area, and you may want to check if that day center does provide those health services. For us, again, we do. So after home health services, a lot of people then are referred to an adult day center by the health in home care programs social worker. So a lot of them have their own home exercise program. That is something that adult day centers can help that individual do their home exercise program at the center. Most of us all provide transportation. For my center or our center, we are outsourcing that. There is an additional cost, or the funder that pays for adult day services incorporates that into the reimbursement that we get. Some centers may also offer therapy. It is not a charge that we are able to charge for, but a therapist could come in and provide some therapy. They then would provide that service through Medicare, but the therapist would be responsible for that. Next slide. Okay, caregiver services. This is such an important part. To me, the caregiver is a very important client of ours. So what we do is have a coordinator that is hired primarily to have the people she deals with is the caregiver. So she provides individual support, as well as all of our staff are trained to be able to support the caregiver. We then also do provide education for caregivers. There's wonderful programs out there called the Savvy Caregiver, and that's for caregivers that are dealing with someone with dementia. We also do powerful tools for caregivers, and that's a program that really helps the caregivers start learning how to take care of themselves. And then we also offer monthly support groups, and most of the adult day centers offer all three of those services to caregivers. What we found is education is probably the beginning part there for caregivers. They're so want more information. And after they've been to a caregiver training, what ends up happening is most of them say, wow, this felt so good to be with other caregivers and learn about our care recipient. And then they want to join the monthly support group. So again, our center in Holland is offering 5 different support groups each month, and we're offering 7 to 8 different caregiver trainings throughout the year. Next slide. Okay, so told you a lot about adult day centers, but what is the benefit of having an adult day center or coming to it? So these are all research-based. I didn't give you all the data about where it comes from, but believe me, I am on the National Adult Day Services Association Research Committee. So I could give it to you if you have questions about it. So adult day centers may slow the progression of dementia. And that is a huge impact on individuals with dementia. All services provided in an adult day center support the improved health of a participant, both directly through health services, but also through those activities that I was talking about, the exercise program, giving them a nutritional meal, which is included during the day. Some of our folks really did not eat well, and now coming to the program, they're getting that nutritional meal. Again, we talk about socialization and all of those therapeutic activities. And there's many research projects that have shown these benefits. The next one is decreased daily stress of a caregiver. And I just want to share for a minute about this research project. It was about done in Pennsylvania. And what happened is they tested the saliva of caregivers. And in our saliva, we have some cortisone chemicals or enzymes in our saliva. They tested them in the morning, at noon, and at night. And what they found is the days that the caregiver sent their care recipient to an adult day center, the stress level or that enzyme decreased. And this is phenomenal research that really impacted me. And I kept asking the researcher and said, you know, does this continue to manifest itself the next day? And he said, yes, they had even figured out that the very next day, after the participant had attended, the stress level was less. So then I wanted him to go further, but he decided it was going to cost too much money to continue this research project, but wanted to know, what if someone attended Monday, Wednesday, Friday? Was that the best way, or was it better to attend 2 days in a row? Well, he thought it was a good idea, but never finished the research project at all. And then the last research benefit or study indicates that individuals with dementia-related behavior problems decreased and sleep improves. So let me quickly share with you. We were closed for 5.5 months due to COVID, and we opened back up, limited capacity at August 19. And one of our caregivers said in the last time we interviewed them, since my loved one has turned to attended the day center again, he is sleeping better, he is less agitated at home, and that's exactly what these studies are showing. And I didn't encourage her to say any of that. It came spontaneously. So I just can't say enough about the benefits of having your loved one come to a day center. Next slide. Okay, so I know the last thing you're going to ask is, how much does this cost? I'm giving you a scale that really is outdated now. I've shown this to a number of people and they have said, oh, this isn't quite right anymore. But adult day services, in my opinion, is one of the least expensive service to offer in a private pay area. So adult day services averages between $75 and $80 a day. Now you think, ooh, that might be quite a bit of money. However, you have to evaluate that if this is a 10-hour day, that's 8 hours, $8 an hour. And what we're comparing it to is other services in the community. So what I like to share with caregivers as they hesitate a little bit and say, I don't know, I'm saying you're getting a lot of hours of service for not very much money. So you have to put it in perspective. I think that's my last slide, isn't it, Carly? Oh, up to questions. Any questions? You're on mute, Carly.
Thank you. I just said I don't see any in the chat. Oh, where are you located? That was a question.
We're located in Holland, Michigan. But again, I don't want to just say I'm representing the day center of Evergreen Commons. I'm also representing all the day centers in Grand Rapids and other areas too. Another question?
I think that's all we have for now. Feel free to send them and we can always circle back to them at the end. It's looking like we're on track to finish a little early, so we should have plenty of time for questions too if you think of anything as we go. But thank you very much, Joe, for explaining the many wonderful benefits of adult day centers. Okay, and then back to Bob, if you want to just speak more broadly on what MAP is, what it stands for, how you go about getting help through MAP. Take us away, Bob.
Sure. So MAP, MAP stands for Michigan Medicare Medicaid Assistance Program. We are a statewide nonprofit agency that is overseen regionally by area agencies on aging. So we have 16 different regions across the state. We're a volunteer program, so we do receive a federal grant, but it is very tiny. So in order to provide our services, we utilize volunteers. So we help answer all types of Medicare questions from people who are new to Medicare. Right now we're in open enrollment period. So we're getting lots of calls on reviewing prescription Part D plans and Advantage plans. So this is our busy time of year. But we also help screen for different assistance programs too. So two primary programs. One's a Medicaid program that focuses on paying the Medicare Part B premium. That's called Medicare Savings Program. And then the other program we help with is through Social Security called Extra Help. This is a prescription assistance program to help reduce premiums, deductibles, and copays. So we help people complete those applications for those programs, get those submitted. But yeah, any Medicare questions, we can do kind of limited on Medicaid questions. MSP we help quite a bit with, but yep, the easiest way to get in contact with us, we have a 1-800 number. You can see that on the screen right now. That is a statewide smart number. So when you call that, it's going to direct you to your local counseling site. So the system looks at your phone number, where you're calling from. So if you have a Kent County phone number, you'll come here to our office. I know I saw Brenda from over in Ionia. So if you have an Ionia phone number, it'll take you to Commission on Aging out there. If you ever need to find us for that phone number, everybody gets their Medicare and U book sent each year. You flip it over to the back, and that's the phone number right there. So give that a call, and we'll help answer any Medicare questions you might have.
All right, thank you, Bob. And then just in general, I wanted to touch on respite services. All of these programs are kind of tie in with respite care and respite services. Certainly, I know our other panelists have spoken on this too. I wanted to touch on respite certificates, and Sarah Sobel, who leads these caregiver university or Caregiver Resource Network, Family Caregiver University classes, would certainly know the most about them. But it is a program that can help offer respite care, which would mean paying for or covering the cost of care for your loved one so that the caregiver can get a break. And sometimes that means just for a couple of hours. The certificates can go for up to 24 hours. I'm not sure how that's been affected by COVID. Sarah, if you want to jump in to talk about that, feel free. Otherwise, we can just move on. And if people have questions, they can certainly ask.
Yeah, thank you, Carly. The only thing I can really say is, and other people probably would agree, that it's been hard to sometimes find the care since there is a direct care shortage, worker shortage at this time. So completing those plans has been a little bit harder. You may have to call a few agencies to find the in-home worker. But a lot of places are still going in-home right now, just with different PPE options. So just something to still think about. Respite is so important and so hard to obtain right now during this pandemic. As Joe said, a lot of their caregivers are so relieved to see that adult day has been open. But, you know, make a plan, quarantine maybe with a smaller group of families. I'm sad to say that I think it's going to continue, and I think winter is going to be tough. Therefore, we need to advocate for our caregivers for them to find respite for this time, because for the future and for the winter. So think about it, if it would be something that you would want to pay to get that respite. You could use some respite certificates. People are limited to up to 10 per calendar year. And like Carly said, it can be up to 24 hours. Usually we use about 1 certificate per like shift of caregiver. It's just so they don't have to handle passing things back and forth. But if you hear anything from me, and I think Carly and Joe and everybody would agree that really think about respite and caregiver burnout is serious during this pandemic. Mara asked, where do you get the certificates? You can call our agency, call our intake department, talk to them. You just need to be in one of our counties that we serve in our 8-region county. Also there is a flyer about respite, and I can get that to you, Mara, if you want to send me an email at Sarah, SARAHS, at 3AAWM.org. I'll also write my name in the chat box if anybody would like the flyer on respite. We didn't add that too, but it is in the millage guide that we did send out with your information as well too.
Thank you, Sarah. And my email will be written at the end too, so if it's easier to just see it, I can always get your email to Sarah too, or send you that myself. So, okay, next community resource I just wanted to touch on. Oh, I see we had one more chat. Okay, thank you, Sarah. She did put her email in the chat for everyone else. So Meals on Wheels I wanted to touch on because I think it's a really great in-home service or community service. They do both. I actually used to work with Meals on Wheels, so I happen to know quite a bit about this program, the Meals on Wheels Western Michigan. This agency covers Kent and Allegan, but I know a lot of COAs, Commission on Aging, will cover this in other counties too. So we're happy to kind of discuss that. If you want to call us, we can help connect you with a local, one of our nutrition partners in another county. But I just focused on this one because it's the one I know best, and I know many others offer very similar things. So for Meals on Wheels of Western Michigan, they offer home delivered meals to those who are 16 older and homebound. I know Bob touched on homebound, and it's kind of the same thing for Meals on Wheels, just being that it is difficult to leave the house. It is not something that is often done. It may still happen for church and special events or whatever it might be for that person, but typically it would mean that this person is at home, and then again that they are 16 older. Those meals will be delivered. They do have a few different options for meals as far as hot meals or cold meals. Theirs do not come hot. I know other programs will come actually like in a bag where it's already warmed up, ready to eat. Theirs come frozen and you can warm them up. Similar to like a TV dinner, but much, much healthier. So that is home delivered meals. And again, this is available in other counties as well. They also offer congregate meal sites, and that would be kind of like going to maybe a nursing home or not a nursing home, a senior center. Or I know we have several senior living apartments that also receive this congregate meal site. So Meals on Wheels actually comes into these places and prepares hot lunches that you can dine at. I believe there's just a suggested donation for that. I think it's like $2 or $3. And if you don't have that donation, they of course will not turn you down. So that's another option. And that's, I know their hope in that is to get food to those who aren't homebound, but still face food scarcity. And then food pantries. Meals on Wheels has some, and many, many other places have food pantries. We are lucky to have quite a few in Kent County. I know other counties have some as well. They have the same phone number for, at least to get started. You can call that 3111 number or go on their website. I thought I heard the sound of a question, but I didn't. So, or you can go to their website, of course, too, to get more information. But that is something I have found that can be a really big help for caregivers, especially if they are the ones preparing meals for themselves and for their loved ones, especially if one of the two of you have special meal requirements. So you're really making 2 different meals for every meal. Just a thought I thought I would include. And then transportation, kind of the same thing. There are several options and will depend on the county that you live in, but I see this as another big barrier for people who are still in their homes and people who depend on maybe one other person for all of their rides and really everything that they cannot do themselves. So here in Kent County, RideLink is a great option. They have a lot of availability right now, which is partially due to the coronavirus. I know that they are really doubling down on cleaning and sanitizing and making sure that it's safe to have people in their vehicles. RideLink is, it goes on all the same routes that the Rapid does in Kent County, and it can go anywhere within Kent County along those routes. So it can pick you up and drop you off at appointments. That's, I think, what most commonly it's used for. There's also the Go Bus, and that is for those who are a little bit more, what's the word I'm looking for? Would need a little more assistance when traveling. So typically people who are wheelchair bound, who can't walk to a bus stop, who couldn't walk it maybe even to the end of their street to catch the RideLink or to catch the bus. They'll come right up to your home, pick you up, take you to your appointment. And there, again, are similar programs. I'm sorry to only touch on Kent County. There are lots out there. And some will go between counties. That's, again, something that we're happy to help with if you have concerns for yourself or others, clients, neighbors, whomever. Oops. We can help you get connected with that. If you are part of our the MI Choice Medicaid waiver program, transportation is also included in that for medical appointments and medical needs. So that is kind of another perk of that program, is that would be one less thing to be stressed out about or have to figure out. But yes, there are different options on that. And then lastly, just if you did want to make a referral, these are the 3 agencies that were represented by our panelists today. So if you have questions about anything that was discussed, you can call our main number here at Area Agency, that 456-5664 number. Care Resources is for the PACE program that Rashay spoke on, and that is their phone number and website, as well as Evergreen Commons that Joe spoke on. That's the number and website. There are certainly many agencies that we talked about what they did, but didn't necessarily name them. So with private duty care, there are a lot of home health agencies that will come into your house to do housekeeping, personal care, whatever it is. There are so many, I didn't list them, but just know that there's a lot out there and we can't help you navigate that if that is a concern. So that is all I have. I don't see any questions hanging out in the chat, but are there any questions out there about anything that was presented on, any questions for any of the presenters or anything that we missed? And you're welcome to just come off mute if that's easier to just talk rather than chat. I think we're good. I'm not seeing anything pop up here.
Okay, I'm putting the Survey Monkey in the link if you can grab that for you to give some evaluations. We're also looking at 2021 with some new topics for Family Caregiver University. So some things to come up with. But as Carly said as well too, always just a phone call away with resources. You know, it's best to think ahead of things, get your name on a wait list as well. Just start knowing what the resources are out there, start having a plan even further than this, also start talking about your loved ones, about what some of their wishes are, how they would like to age, what that would look like as well, and get resources for that. So feel free to fill out the survey. Just to remind you, you did get an email, and on that email should have been the PowerPoint, some handouts, talking about our presentation where we're doing next week about part 2 about transitioning to in-home care if you would need it. There's the 2020 millage guide on there, which talks about all of our millage services. And then there's an outreach sheet on there talking about some of the requirements for these programs as well. So you can take a look at that. We'll just leave it open for a couple more minutes. If anybody else had any questions that they wanted to put in the chat box or unmute yourself. And again, we're just hopefully a phone call away or an email, so let us know. But we hope that we can at least get you started to thinking about this journey as well. So please fill out the survey. We really appreciate that. Sometimes it's hard to get those survey responses when we are virtual. So if you can fill that out, that's great. Thanks again, Carly, for your job in coordinating it. Roche, Bob, and Joe, thank you again for presenting. And I hope that you all have a great day. So thank you very much.
Thank you, Sarah. Thank you, everyone.
Yes, thank you. Goodbye.